Hello, and welcome to our video on sickle cell anemia. Sickle cell anemia is a genetic disorder that affects erythrocytes, RBC, causing them to become sickle or crescent-shaped. The effects of this condition are due to an abnormality of the hemoglobin molecules found in erythrocytes. These irregular-shaped cells get stuck in small blood vessels and they block blood flow and oxygen. Sickle cell anemia is caused by a change in the gene that tells the body to make the iron-rich compound in red blood cells called hemoglobin. Hemoglobin enables red blood cells to carry oxygen from the lungs throughout the body. The hemoglobin associated with sickle cell anemia causes red blood cells to become rigid, sticky, and misshapen. For a child to be affected, both mother and father must carry one copy of the sickle cell gene, also known as the sickle cell trait, and pass both copies of the altered form to the child. Sickle cell disease is one of the most common inherited blood disorders worldwide. It affects millions of people around the world. Still, sickle cell disease is more common in people with ancestral links to Africa, Mediterranean countries, India, the Arabian Peninsula, the Caribbeans, along with South and Central America. In fact, it's estimated that there are around 300 million people with sickle cell trait, and that approximately 1 in 3 of such cases is in sub-Saharan Africa. In the United States, most people who have sickle cell disease are of African ancestry or identify themselves as Black. About 1 in 13 Black or African American babies are born with the sickle cell trait. About 1 in every 365 Black or African American babies are born with sickle cell disease. Many people who come from Hispanic, Southern European, Middle Eastern, or Asian Indian backgrounds also have sickle cell disease. About 100,000 people in the United States have sickle cell disease. If both parents have SCT, there is a 25% or 1 in 4 chance that any child of theirs will have SCD. There is the same 25% or 1 in 4 chance that the child will not have SCD or SCT. People who inherit one sickle cell gene and one normal gene have sickle cell trait or SCT. People with SCT usually do not have any of the symptoms of sickle cell disease, SCD, but they can pass the trait along to their children. There are several different forms of sickle cell disease, and it's different for each person. 3 types of SCD exist most often in the United States. Hemoglobin SS, also known as sickle cell anemia, hemoglobin SC disease, and hemoglobin sickle beta thalassemia. The most common and usually the most severe form is sickle cell anemia. The SCD type affects the severity and frequency of complications. The type of SCD also impacts the timing of complications. Some people have symptoms at a very young age, while others will not show symptoms until adulthood. Initial symptoms of sickle cell disease often appear during early childhood when a child is a few months old. Although symptoms and severity of sickle cell disease vary significantly amongst people, common symptoms of sickle cell disease include episodes of pain, anemia, fatigue, shortness of breath, and frequent infections. Common symptoms observed in babies include jaundice, swollen hands or feet, along with anemia-related fatigue and fussiness. Sickle cell disease may also cause spleen damage, which could make them more vulnerable against bacterial infections. As it deprives tissues and organs of oxygen, sickle cell disease may cause serious damage to the lungs, spleen, kidneys, liver, and the brain. As a result, people suffering from sickle cell disease are also at increased risk of developing long-term complications such as pulmonary hypertension, reproductive problems, vision problems, and critical complications such as organ failure, acute chest syndrome, and stroke. Sickle cell disease is most usually detected during routine newborn screenings or pregnancy screenings. However, blood tests both to check for sickle cell disease and sickle cell trait are widely available for everyone. Moreover, through diagnostic tests analyzing small samples of placenta, chorionic villus sampling, and the amniotic fluid amniocentesis can be used for screening purposes during pregnancy. Rapid4 Sickle Cell Rapid Test Kit. The disorder situation for sickle cell can be diagnosed easily and safely. This test kit is designed for in vitro, qualitative determining the subtypes of hemoglobin, HbAA, HbSS, HbSc, and HbS-beta, in human whole blood samples. The only cure treatment that could potentially cure sickle cell disease are bone marrow or stem cell transplants. However, these are highly risky operations, and research on treatment strategies for sickle cell disease is still ongoing. The current treatment strategies for sickle cell disease focus largely on the prevention of complications and management of symptoms associated with the condition. Such treatments include vaccines and penicillin against infections, blood transfusions against severe anemia, transcranial Doppler ultrasound (TCD) for the early detection of stroke risk, and pain-reducing medicine for the management of pain. There are also some specific treatment medications such as L-glutamine, hydroxyurea, and voxelotor that can be used to relieve symptoms and reduce the risk of complications depending on the symptoms, infection severity, and overall health of the patient. Researchers are exploring whether inserting a normal gene into the bone marrow of people with sickle cell anemia will result in normal hemoglobin. Scientists are also exploring the possibility of turning off the defective gene while reactivating another gene responsible for the production of fetal hemoglobin, a type of hemoglobin found in newborns that prevents sickle cells from forming. Several of the initial hurdles to SCD gene therapy appear to have been overcome. It's prudent to recognize barriers that remain. Gene engineering methods are rapidly evolving and should facilitate development of second-generation gene therapy approaches in the coming years. After many years of preclinical laboratory investigation, gene therapy options are now on the horizon for patients with SCD. Thanks for watching, and have a great day.